Causes of diabetes. Diabetes causes differ according to your genetic makeup, family history, ethnicity, health, and environmental variables. There is no single diabetes cause that applies to all types of diabetes, since diabetes causes differ based on the individual and the kind. For example, the etiology of type 1 diabetes differs significantly from those of gestational diabetes. Likewise, the causes of type 2 diabetes differ from those of type 1 diabetes. In truth, the causes of type 1 diabetes and type 2 diabetes are completely different. Type 1 diabetes is an autoimmune disorder which the pancreas is unable to generate insulin, whereas type 2 diabetes is caused by the body resistance to insulin. Type 1 diabetes is caused by the immune system killing insulin-producing cells in the pancreas. Diabetes is caused by the body not producing enough insulin to operate correctly. Because the body is attacking itself, this is referred to as an autoimmune reaction or autoimmune cause. There are no definite diabetes causes, although the following factors may have a role. Infection from a virus or bacterium. Toxic chemicals in food. Unknown component producing an autoimmune response. Type 1 diabetes cause might potentially be an underlying genetic tendency. The causes of type 2 diabetes. Type 2 diabetes causes are frequently complex, which means that more than one diabetes cause is at work. A family history of type 2 diabetes is sometimes the most overpowering risk. This is the most likely cause of type 2 diabetes. Type 2 diabetes has a number of risk factors, any or all of which enhance the likelihood of getting the illness. These are some examples. Obesity. Sedentarism way of life. Getting older. Poor dietary habits. Other causes of type 2 diabetes, such as pregnancy or sickness, might be risk factors for the disease. The causes of gestational diabetes. Diabetes in pregnancy, commonly known as gestational diabetes, has no recognized etiology. However, there are a number of risk factors that increase the chances of developing this condition. A family history of gestational diabetes. Obesity or being overweight. Having polycystic ovary syndrome. Having baby weighing more than 9 pounds. The causes of gestational diabetes may also be ethnic. Some ethnic groups are at a higher risk of developing gestational diabetes. Other causes of diabetes. Diabetes can be caused by pancreatitis or a pancreatectomy. These are known to increase the chances of acquiring diabetes. Polycystic ovary syndrome, PCOS. Obesity-related insulin resistance is one of the fundamental causes of PCOS, and it may also raise the risk of prediabetes and type 2 diabetes. Cushing's syndrome is a medical condition in which the adrenal glands overproduce. This condition causes an increase in cortisol hormone production, which leads to a rise in blood glucose levels. Diabetes can be caused by an excess of cortisol. Glucagonoma. Diabetes may occur in patients with glucagonoma due to a loss of balance between insulin and glucagon production levels. Steroid-induced diabetes. Steroid diabetes is an uncommon kind of diabetes caused by steroids.